Hello, viewers at home. Welcome to yet another exciting moment with us on this program, Women's World. This is all about women. We look at things that has to do with women, our health, our way of life, and all that. Today we're looking at something that is significant, which is the breast. We're looking at breast cancer. We're going to be having we're having a nurse in the house that will be telling us more about this. I'm having Mrs. Shokpeju Lawa, nurse from the from government hospital. You're welcome to this program.
Thank you very much.
So it's she's going to be telling us about breast cancer. So now, what is breast cancer, ma'am?
When we say breast cancer, we mean that there is a cancer that is present in the breast. Cancers generally develop as a result of abnormally dividing cells which damage the cells tissues of the body.
Okay.
So when there is that presence of damaging cells in the breast, that is when we refer to it as breast
Damaging
cancer.
cells.
Yes.
Okay. I thought it's when some cells grow.
They grow abnormally.
Okay.
Maybe as a result of infection. So they overgrow.
Check yourself once a month, 4 to 5 days after your periods. Let us show you how to examine yourself in 5 steps. Step 1. Look for any change in your breast and nipples. Observe the shape, colour, size and contour. Step 2. Stand in front of a mirror. Use your index, middle and ring finger. Gradually keep increasing pressure in a circular motion. Follow a simple U-shaped path. Starting from your armpit, move to your bra line, then onto your breastbone, and finally to your collarbone. Check yourself in different positions. Step 3. You're looking for lumps, swelling, thickening, dimpling, discharge, persistent pain, loss of contour, puckering, redness. Step 4. Any changes must be reported to your doctor at the earliest. Step 5. For women over 50, routine checkups and a mammogram once every 2 years is recommended.
Massage and palpate the breast. You start from round, surrounding the nipples. Palpate round, feel, and roll the breast in your hand with the tips of your fingers. You do it in a circular motion, then to the nipple side. Then you feel at the armpits if there is any lymph nodes there. Then after doing that, you check the other side as well. Then if you detect that there is any lump there, you go for a medical attention. So that is where they will take it up from you in order to detect if it is cancerous or it is not cancerous.
Okay. Continue.
Then we have another sign. There may be discharges from the nipple.
Okay.
Then the lump site will be painful and reddish. Then the armpits, you will feel a kind of lymph nodes there, which will tell you that
What is this lymph nodes?
lymph nodes is a kind of swelling. It will swell. There are times when people say when men are having a kind of a pain at their genitals, there will be a kind of I cannot call it a growth, a kind of inflamed tissue at the part of the groin side. At the part of the groin side, they will massage it. It's called petele in Yoruba.
Okay.
It's called petele in Yoruba. So you feel the lymph nodes if it is in the armpits. Then there will be a kind of the skin of the breast. It will look like dimples, like that of the orange. So those signs will tell us something is wrong.
Okay. How about the nipple going inside?
That one is another case on its own. We call that inverted nipples. So it doesn't have to relate with cancers.
Okay.
So most especially, what will happen to the nipple is that you will, if peradventure you press the nipple, there may be discharges from it. It may be bloody, it may be leakage.
Okay.
So those unusual bleeding and discharges will tell us that something is coming. Yes. Okay. And we have some danger signs of cancers.
Okay.
The danger signs are, one, I've said it among the ones that I've mentioned. We have when there is lump,
Okay.
a lump that is there that we can see. Sorry, that we can see. Then when we have a kind of a abnormal growth of lump. Then we have when there is a kind of nagging cough or harshness. Then there is unusual bleeding. Then there is increase in mole or what. That mole or what is just like a lump, but it continues to grow.
You said earlier on that when there is a movement, can it be all movement, or maybe it will stop after a while or something?
No, it's not that all movement in the breast is cancerous. So that is why we need to get a medical practitioner that will help us to palpate the breast in order to know which is which.
Okay. How about breastfeeding? Some women, I read somewhere that when one is supposed to breastfeed and they not breastfeed the baby, that it can cause cancer, and also maybe one is of age above 30 and has not gotten any issue, it can cause cancer, and also maybe 50 above. I want you to clear those areas.
So actually, like I said, the cancers runs in the family. If there is peradventure an individual in the family has the history of the breast cancer, the female in that family should be at alert and try to monitor any changes that occurs in the breast. Those breastfeeding mothers, actually there are some women that that has this virus. Some, they will tell them they should not breastfeed, but now they've been breastfeeding. So let's take for example that a woman that gave birth and they said she should not breastfeed. That does not mean that the person will have cancer, unless if there is tendency for the person, as there is breast cancer that runs within the family. So the person will have to monitor herself to detect early if there is any signs or symptoms of cancers.
Okay. How about the age issue?
The age, we say after 40 and above, one should try to do some investigations relating to diagnosis of cancers. Okay. Even at early stage, like the teenagers now, we have histories that they are having breast lumps, and some, if care is not taken, may lead to breast cancers. That is why I said earlier that breast self-examination is mandatory.
Okay. So now, like when the breast is removed to that advanced stage, as in when it is in that advanced state and the breast is removed, is there a way that we will have breast reconstruction again?
Actually, they do a kind of what can I say? Artificial breast. Okay. We advise them to use it. Some may use patch, so you will not even know if the breast is not there or not. You will see it as it is naturally there.
Okay. So how risky is this? Or let me say, how long, when one detects this issue, how long should one wait, or should one quickly go to the hospital to get the doctor's attention?
Okay, I think it should be very urgent, because the more you wait, if it is cancerous, the lump will start to grow, and before it gets to to damaging other surrounding cells, one should take immediate steps to curb the development of the lump.
So now, like, can one go to anywhere for screening or checkup?
I don't think one should go to anywhere, most
Any
especially
hospital?
when there is, yes, you can go to state hospitals, you can go to teaching hospitals.
The treatment, how available is it?
The treatment is very much available. It's very, very much available.
So we are talking about the stages of cancer. Have you really dealt with that?
The stages are 4. We have stage 1, stage 2, stage 3, and stage 4.
Okay.
So it depends on the symptoms that is revealed that will tell us the stage. Then if we do a kind of a histology, we culture that lump that is present. After removal, we try to do a kind of a biopsy. We take the lump. If we detect that there is a lump in the breast, we take the lump, and it's a miniature surgery. So we incise the place and take out the lump and send it to the lab for histology. So that's the result that comes from there. Will tell us the stage of that cancer.
So now, someone that has breast cancer, can person, let me say person has not gotten babies and all that, can person still have baby?
Of course,
children?
the person can still have. If the breast is gone, we can place the baby on
As in,
formula feeding.
it's not going to affect the
It will
fertility
not
and all that?
affect any fertility processes.
Okay.
It won't, since it's not in the genital areas, so it will not affect.
The drugs and all that doesn't have side effects.
Actually, the only side effect it has is that there may be a kind of a nausea, wanting to vomit or vomiting, then
Losing of hair.
When it got to that advanced stage, so then loss of appetite and all those little.
Okay, we'll be going on a break. When we come back, we'll still continue on this. Do stay with us, don't worry.
It is estimated that 1 in 14 women before the age of 75 will develop breast cancer in her lifetime. You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following 2 positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These 2 positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breast, underarm and collarbone areas more accurately, do so by lying down because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area, any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion.
Use 3 varying pressure levels, light, medium and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
You're welcome back. We'll be looking at breast cancer, and here with me in the studio is Mrs. Shokpeju Lawal from the government hospital in Ijebu Ode. You're welcome once more, Amy.
Thank you.
So now we are looking at breast cancer. Now we've not dealt with the type. Can you tell us about the types of?
We have 2 types of cancers. We have the benign and the malignant. The benign cancers are such that it doesn't spread to all other tissues in the body. While that of malignant cancers, it spreads to other tissues of the body. That is what we call metastasis. It affects all other organs.
Okay.
Then the benign tumor might at times lead to malignant, and it reoccur.
Okay. So now, is it just women that has breast cancer?
Actually, men also have breast cancers, just moderately.
Okay.
Because we have some men that has a kind of feminine structure breast, so they have that look that there is breast in this man's chest. So some men do have, but it's not really common. It's not really common.
So now, what are those things that women need to do to limit their chances of having breast cancer?
Number 1, I've talked about the breast self-examination. That needs to be done monthly, irrespective of the age. Then exercises. You don't need to live a sedentary life. You try to work on yourself. Then the eating habits. You have to limit some fatty foods, go on vegetables, then eat fruits. Then if it's the type that takes alcoholic, you have to stop taking the alcoholic. Smoking should be stopped as well. Then majorly exercises.
Okay. Now your take to people at home, your advice to them about their health and all that.
I will advise people at home, particularly females, that we should always check ourselves every month. We should note if there is any kind of differences in our body as per what we have been having before. Then most especially teenagers, we should try to cultivate the habits of doing breast self-examination every month, immediately after or during our menstruation. We should try to do that breast self-examination by ourselves, like I have described. Then if we notice any kind of changes in our breast, don't let us hide ourselves that people will know they will start to stigmatize me. There's nothing about stigmatization in breast problems.
It can happen to anyone.
It can happen to anyone. So you move out on time to seek medical advice. Early diagnosis, early treatment can curb the progressive extent of cancers.
Thank you very much, man. And thank you, viewers at home, for being there. You've heard it all. For us to be healthy, health is wealth, I guess so.
Yes.
We should try and take care of ourselves so that we can be healthy. Thank you, and thank you, viewers at home, for being there. Until come your way again on the same program next week. Bye bye.
Bye.